Welcome, everyone. I see people coming in. That's great. We'll maybe give it another 30 seconds or so. Thank you so much for joining us today. We've got a good grouping of folks joining us all across the U.S., all time zones. Okay, well, let's go ahead and get started. We have an incredible lineup of speakers today, so I don't want to waste any time just diving in, but on behalf of NASSP, I'm thrilled to be joining you today and having everyone participate in the first of our series of Be Well campaign centering mental health in schools. I'm Jen Silva, Director of External Relations for NASSP. And like I mentioned, we are just joined by amazing school leaders and our federal partners to share with you some experiences, best practices, and resources. They will each present for a few minutes, and then we will have some time for Q&A at the end. So please do put your questions in the chat as we go. So with us today, to start us off, is Ron Nazoy. He's our CEO of NASSP. I know he wants to share a few words with you. Ron?
Thanks, Jen. Aloha, everyone. Thank you very much for making time to join us to talk about these very important topics today. A couple of things for our school leader friends in the audience. Thank you very much for your leadership and the work that you do for children and families every single day. This is a busy time of the year, I know. So if you're tuning in, I know it's amidst juggling a whole bunch of other things, but really appreciate your leadership, not just in the field, but especially on the topic of mental health and making sure that everybody is well. We're joined, as Jen said, by an amazing group of folks today who you'll get to meet in a minute. And I just want to impress upon everybody here, we've known this from far before the pandemic, that mental health and wellness matter in the terms of human development. And we know how important it is for people to feel a sense of security and safety and belonging in order to move up the sort of Maslow's hierarchy towards self-actualization. And I think the pandemic has shown for us how fundamental the importance of wellness is in the development of people. And so we're here over the course of the series of wellness to shine a light on well-being. And we couldn't be happier to have this amazing panel and presenters today to help us really raise awareness and make sure that everybody understands that these are not nice to have things. These are not luxury type things. These are essential services and supports that people need in order to just be the best versions of themselves. So as Jen said, there's way too much expertise in this panel for me to keep talking. So thank you very much for joining us and enjoy not only this webinar, but also the series. Back to you, Jen.
Thanks so much, Ron. So I'll go ahead and mention all of our speakers today, and then they will share a little bit of updates with you. We have with us Elizabeth Connolly, Assistant Director for Public Health, White House Office of National Drug Control Policy. We have Karen Howard, Director of Policy and Advocacy for Mental Health America. Jen Waite, National Lead, Youth Market, American Heart Association. Aaron Eiler, Principal, Matawan Regional High School, Aberdeen, New Jersey. John Geis, Principal, Shelby High School, Shelby, Ohio. Mayalise Tolan, Secondary Director, and who has also served as a principal, Lincoln County School District, Toledo, Ohio. Chris Young, Principal, North County High School, Newport, Vermont. And we are still waiting on our student. He's probably in class trying to rush out, but hopefully he'll be able to join us, Jeremiah Castillo. He is our NASSP 2023 National Honor Society Scholarship winner and is a senior at Technology High School, Newark, New Jersey. So before we go into our speakers today, just to share a few words about our campaign on Be Well, we want to bring our voices together, our resources together, advocate for increased practice, funding, and policy around mental health services. This is our effort to really, truly dive into eliminating stigma, increasing conversations, talking openly about what we are all facing, what educators are facing and students. We're dealing with issues like depression, addiction, drug prevention, mental health illness, suicide, social media, school safety issues, and so much more. So I want to share a little bit about what our goals are for the campaign. But as I do, please do share with your contacts and connections that there is a really simple way to access immediate and safe help through the National Mental Health Crisis Hotline by dialing 988, 24/7 crisis support whenever you need it, or someone else that you know needs it. So in our campaign, our goals are to raise awareness and advocate with legislators on the importance of student and educator mental health services. And just yesterday, we saw there's a Surgeon General's report came out on social media and youth mental health. So those resources in that report will be in the link in the chat, as will other resources throughout our presentation today. But this effort that we're getting involved is in multi-agency, requesting urgent action needed, both from Congress, but also from communities. So this will be our tie-in to our next webinar on Be Well, having to do with online safety. So that will be on August 23rd at 4 o'clock with our partner, I Can Help. And hopefully everybody will join us for that webinar. So throughout our campaign, you can get involved following ways. You have our NASSP Action Alert, asking Congress for mental health services increases through funding and policy. So that link will be in the chat. We're also working with our Principal Recovery Network. These are school leaders who unfortunately have been suffering and have suffered through school shootings. They're made it their life mission to support everyone from communities to school leaders to students to families. So we'll be in DC with them, talking with our legislators and our federal partners on mental health services, school safety measures, as well as sharing out their guide to recovery. So we will also share out in the resource list our 2023 legislative agenda. And I just want to quickly share a few little highlights here. So share my screen just so you can see what that legislative agenda is about. Hopefully you can see my screen. Be Well, centering mental health in schools. You'll see the action alert here. And just real quick, we've got a legislative agenda that includes policy, and mainly these areas of policy have to do with staffing, training, educators and school leaders, and everybody involved in the school system. So you'll see these bills that address increasing access and increasing partnerships. So when you have a moment, take a chance to look at these. These are our legislative agenda that we've been talking about, from our National School Leaders Conference to our Principal Recovery Network and ongoing as we work towards increasing funding and policy. And then the last two pieces on this, again, requesting additional on-site licensed mental health professionals and additional community coalition support and clinicians as we enter a lot of work in the trauma-informed instruction and care. And lastly, we've got a couple of areas in our budget priorities. We've got Title II Part A. So lots coming out with that, especially next week. We have our Title II Part A increase letter. You'll see that. This strengthens a lot of our opportunities for teachers and principals, providing in-service training for students affected by trauma. Again, school staff training. And last but not least, we've got our Title IV Part A that deals with support and mental health of students, and also our Project Serve grants increase request. So lots of legislative agenda pieces, but I just wanted to do a quick little highlight on that. That resource will be available to you through the links that we share. At this time, I'd like to shift it over to our first speaker, Elizabeth, who will share some updates with you. Elizabeth, please go ahead and take over. Thanks.
Thank you, Jen, and thank you to everyone. It's really my pleasure, and I bring you greetings from the White House. These issues are very important to the Biden-Harris administration, so I'm very honored to be with you. And as the wife of a long-term public high school teacher in New Jersey, I know what time of year this is for all of you, but so thank you for carving out time to really listen to all the speakers today. So I'm going to talk to you about the Office of National Drug Control Policy and what we do, which is oftentimes because we know the intersection of mental health and substance use. So my remarks will focus primarily on substance use as related to youth populations and the population that you all work with. So at the Office of National Drug Control Policy, we develop and implement public health approaches to reduce drug use and its consequences. And we do focus on the Office of Public Health: prevention, harm reduction, treatment, and recovery, and all with an equity lens. And so I'm going to start by just prefacing that the U.S. Department of Education has a number of mental health resources available at their website. And I believe all the website resources that I'll be talking about have been provided to you in the chat and be available to you afterwards. So in terms of primary prevention, ONDCP oversees the drug-free community supports programs. And these are community-led efforts centered on primary prevention. And there's about 745 DFCs across the United States. And they are excellent partners with school districts and individual schools because they really listen to the community, they're community-led, and so really take into view the unique needs of every community. So as you're looking at primary prevention resources, I would turn to the DFCs. I think they're a great one. In addition, the National Institute on Drug Abuse, which is housed at the U.S. Department of Health and Human Services, you might know it as NIDA, has published a guide about preventing drug use among children and adolescents. And this guide is a compendium of resources, which also highlights the actual evidence-based used to compile these resources. In addition, the U.S. Department of Health and Human Services Substance Abuse and Mental Health Services Administration, or SAMHSA, has provided a compendium of behavioral health, which includes both mental health and substance use resources specifically for youth. ONDCP has also worked over the past year with the U.S. Department of Education on a series of webinars that are focused, the first set of 3 were focused on resources for prevention of substance use and resources that schools can tap into, also on the evidence base. And then recently, we did another series of webinars focusing on fentanyl. So fentanyl is a synthetic opioid that is so potent that even a tiny amount can be fatal. And as we've heard, seen in many schools, so tragically, and communities, as that the rise of illicit fentanyl has really had a disproportionate impact on children. The overdose deaths among adolescents doubled from 2019 to 2020, and they continue to rise. And even though the youth rates of drug use have remained stagnant, the overdoses have increased. And that's because we know that teens can log into social media, and I know as Jen referred to the Surgeon General's report earlier, and in the palm of their hand buy what they believe is a pain medication or some other prescription, which in fact, it is an illicit medication, and many contain fentanyl. And the Centers for Disease Control and Prevention have put out a report and talked tragically that children who overdose often have a bystander present. And that's why we're really focusing on making naloxone available in schools and homes. It's really critical to have this overdose medication available. The White House has worked on 2 fentanyl awareness campaigns which highlight naloxone, and they target middle school and high school students. The first can be found at the website realdealonfentanyl.com, and the second is a social media influencer campaign. So the first one really focuses on, it's something you can log into, you as a parent, as a teacher, as an administrator can log into and view all the resources that are there. It talks about how you can obtain naloxone. The second is an influencer campaign, and we know that students are following on social media a variety of influencers, and these influencers were selected because they reach a very large audience of our targeted age students, and their message is about overdose and preventing overdose and having naloxone available. Also, the FDA has just approved one of the formulations of naloxone to go over the counter. We should see that on the shelves in September, so just in time for back to school. So those are a few resources that we wanted to highlight. Again, thank you for all the work you do, and I'll turn it back to Jen.
Thanks, Beth. I really appreciate it. Like I said, I know this is a lot of information, but please, take a chance to look at all of the links. And then when we send out, after the webinar, we send out that list of links. Please do share those with your networks. Okay, next up is Karen. She's going to share some updates from Mental Health America. Karen?
Hi, everyone. I'm Karen Howard, the Director of Policy and Advocacy at Mental Health America. We're a consumer advocacy organization that's been around for over 100 years. We are based in the Washington, D.C. area. I'm a graduate of Maryland Public School System and have affiliates in 42 states. So our affiliates are large or small organizations doing advocacy, sometimes with schools and other times in other community areas. But our whole real focus is moving upstream to prevention and early intervention, as we also discuss the rights and liberties of individuals with mental health conditions. People with mental health conditions have historically been criminalized, institutionalized, and otherwise not given a full opportunity to live in recovery. But with research over the last several decades, we know that over 95% of people with mental health conditions can live in the community on their own or with supports, and that it's important that policies support this. I'd like to highlight our online screening program. MHA's screening program has 10,000 people visit our website a day to take a screening for psychosis, anxiety, depression, eating disorders, now ADHD, and other conditions. And 38% of those people taking a screening are under the age of 18 in the US. We know it's a very young help-seeking population, and so all of our efforts are really focused towards helping policymakers understand that mental health conditions present signs and symptoms in 75% of people by age 24 and in 50% of people by age 14, yet there's a 12-year delay between when those signs and symptoms first present and when a person is connected to services. Closing that gap means we need more mental health education in schools, more accommodations and supports that precede services, such as peer support or mental health sick days and grace periods for making up work or taking tests virtually, depending on what a student's individual's needs are. It also means that beyond universal screening, education, and support, that we do have qualified, trauma-informed, and culturally comprehensive, culturally responsive care by professionals that are hired either by the school system or that are working through school-linked programs. We know that educators and school personnel are the first line of defense and are really carrying a strong load and a heavy load in helping to carry along our young people, and that sometimes the difference between a young person who has a mental health condition or an emotional disturbance and whether or not they have a crisis and end up with poor outcomes is whether or not they have a caring adult in their life. So thank you for being that first line of defense. We have a whole lot more to share, including some bills that we've been working on, as well as programs that you're invited to join to learn more and to help engage young people in being forefront and center, including we're happy to welcome the National Institute of Drug Abuse's director to our Policy Institute on June 6th. And you all are welcome to join that to discuss video gaming and ADHD and some of the other substance use prevention interventions that we're in support of. And I look forward to talking a bit more about our back to school toolkit and programs that we have for youth, as well as how school districts can engage Medicaid billing in in paying for services that are needed, whether or not you're a really large school district or a really small one, that there are models in place that have been highlighted by CMS to help ensure that there's enough financing of good services, since we know that for Latino and Black youth and other youth of color, when services are provided in schools, they oftentimes are more effective and the students stay in those services because other barriers to access have been removed. So thank you so much for having me. I look forward to the discussion.
Thanks so much, Karen. I want to invite Jen Waite to share some thoughts.
Thank you so much. Well, good morning and good afternoon to all of you. You know, at the American Heart Association, you may be familiar that we're dedicated to fighting heart disease and stroke, but we are really focused on both physical and mental well-being. So to us, that really includes physical, emotional, psychological, and social health. And we have been working with schools and within schools for 45 years through our Kids Heart Challenge and American Heart Challenge programs. But we also, I did want to share, we have a teacher well-being toolkit that will be coming out this summer. So in talking to a superintendent the other month, she had said something that really resonated, and it was that kids are the most important, but teachers are the most valuable. And so we want to be alongside y'all just to make sure we know teacher recruitment and retention is a crisis and a challenge right now, that we are addressing both student health and teacher health as well. But, you know, research has shown that mental health really has psychological effects on the body. And whether you experience trauma, depression, anxiety, or stress, you know, that causes your heart rate to go up, high blood pressure, and things like that over time can lead to heart disease. And so today I do want to share and chat a little bit about vaping and share some resources with you all. So I'm going to have some visuals for you here. And so, not surprising, the first one I want to share is just, we know that there is mental health crisis and also a vaping crisis among youth. And these products are delivering highly addictive nicotine, but also marijuana being a use as well that we'll be looking at. And we remain with 1 in 5 youth students vaping in the past few years. And you can see how this really breaks down. And over half of people are using both nicotine and cannabis. And the dual use is the highest. And we see it tied so highly to stress, to anxiety. And, you know, students, youth believe it helps them to feel calm or to feel less depressed. And so young people who are vaping are much more likely, whether it's nicotine, cannabis, or both, to report anxiety, depression, or suicidal thoughts. And so I want to share some of the resources that we have with you all. One of them is our tobacco-free school kit. So we believe in a non-punitive approach. And you can find this kit at heart.org anti-vaping. And there's, you know, a strong position for schools here to help students and to ensure that they stay in school as well, to help support them versus being punitive. And so a great toolkit there. We also have a partnership with Text to Quit. So students are able to get texting help, which is really great. You can absolutely try it, text that number and see what that looks like. But cessation intervention, it's a really wonderful partnership. And then we also have a student-led, student to student. It is called Tobacco Endgame. And so this website where students will find videos from other students, resources, they're able to join the movement from an advocacy and legislative place as well. And so those are just a few of our resources and recommendations as we really look to help tackle vaping and the mental health crisis as they are tied together. So thank you, Jen, for the opportunity.
Thanks so much, Jen. And thank you to all of our federal partners, including, everyone involved in government relations. I mean, this is really the heart of the work to get things done, not just locally, statewide, but regionally and federally. So thank you so much for our partners to share a few thoughts and resources with us. At this time, we're going to switch over to our school leaders, and also want to say hello to Jeremias, who just jumped in. He'll be our final speaker, but thank you so much, Jeremias. I know he's running in from class and final exams. So thanks, Jeremias, for joining us. Okay, so first off, we will go with Aaron Eiler. He'll share a little bit of updates from his school and school district. Thanks so much, Aaron.
Thank you, Jen. Good afternoon, everybody. In listening to all the previous speakers, schools and my position, I guess principals in general, are in a unique lens where we are seeing the cross section of all of these different things happening at the same time, and it's incredibly scary. We're seeing the increase in the vaping, whether it be nicotine or marijuana based, the way that Jen was explaining. And we're seeing that the reactions or the ways in which we're trying to combat these issues are not being effective. We're having a very difficult time making sure that we are able to assist students and maintain a safe environment for everybody. And I don't want to make it seem like it is a doom and gloom situation that's taking place within schools. It's just a matter of the need and the urgency to address a lot of what young people are experiencing on a day-to-day basis is at that level. In New Jersey, we have one of the most stringent bullying laws in the country. I would encourage everyone to go on to the New Jersey Department of Education website and read it. Our anti-bullying Bill of Rights is intense. Just 2 weeks ago, I was testifying before the Joint Education Committee for New Jersey, and we were talking about bullying, but more and more that we were having the conversation, and it went on for about 4.5 hours. Everyone was starting to really come to the realization that the bullying element is bad, but it is then also mushrooming a number of other topics, particularly when it transcends into the cyber world, because the experiences that kids are having now, when I was in school and I graduated high school in 2001, I'm very transparent about it. I like to think it was not that long ago. At the end of the day, when I went home, if I didn't want to interact with somebody, or if I needed an escape, I was very much able to do that and to not have, my device buzzing next to me at all times of the day with social media and things of that nature. Kids now, I really believe one of the biggest skills that we can teach them is the ability to disconnect from the virtual world that they are entrenched in 24 hours a day. Because a lot of the times when we get down to, and I'm not an expert in terms of diagnosing mental health, I don't want to ever make it seem that I'm coming from that angle, but I firmly believe, as a parent of a freshman in high school, a 7th grader, and a 7-year-old, but also as somebody who gets to interact with 1,300 students every single day, I really believe that one of the biggest obstacles that we have right now is trying to teach kids the ability to disconnect from the virtual world, from where they may be seeing things that are not appropriate and from where they're experiencing things that make them uncomfortable. And then we don't have time to do this, but if I could go all the way back to how I started this conversation and frame it through the lens of what we're seeing with adults, I think we need to teach adults the same thing. Because I think one of the biggest issues, and I apologize, I forget who had brought it up before about students are the most important, but teachers are the most valuable. If we have people in front of kids who are having these types of difficulties with disconnecting from social media, with mental illness, being able to take a cognitive break from their daily lives because they go home and they're attached to their email at all times, they're getting text messages, they're on social media. I don't know that all adults have the skill and the ability to disconnect either, which in my mind is one of the biggest things that we are seeing, at least at the high school level, and I would venture to say all the way down to the earliest kids that can get cell phones. And I don't want to make it a cell phone conversation, but I do think a large majority of what we're experiencing in schools right now is a derivative of kids growing up in a digital world as opposed to a physical one. And with that, I'll turn it back over to Jen. Thank you, Jen.
Thanks so much, Aaron. Appreciate those thoughts and resources that you're sharing. John?
Hi, John Geis, Shelby High School, small district in Ohio, about halfway between Cleveland and Columbus. So we have cornfields surrounding us. We don't have some of the problems that some of our bigger city places have, but we have a lot of the same ones that a lot of our bigger city places have too. I think one of the things that we've seen over time is that, yeah, it was really hard, obviously, going through the pandemic stuff and all the things that brought, but schools are trying. We are trying to come up with some ways to help our students and our teachers. And that's a really good thing. And I'll highlight some of the things that we're seeing in Ohio, but that vaping data, dead on. Oh my, I think we could all agree with that. I wish I could make this up, but we had and talking about families too, and dealing with families, we had a student, my assistant principal walked out to the car who he had caught vaping. And when he got in the car, told the mom that the kid had busted for vaping in the bathroom, and she smacks him upside the back of the head and knocked the ashes off her cigarette that she was holding in her hand when she hit him. So, we're dealing with the same stuff with, like Aaron was saying, with families. It's really, really hard. And that's one of the things we're seeing too. A lot of studies have been done. I mean, the number of students who are increased and feeling sad and hopeless has just really gone up so much. Schools have really had to focus on not just teaching, our standards. We're spending a lot of time dealing with the social emotional issues, the different programs and things that we can do. Our focus has been on trying to get kids to feel that sense of belonging and to become part of school and bring something back to them, to get that normalcy kind of coming back. And it was really interesting because I know Aaron talked about cell phones. We had after prom a couple of weeks ago, and one of our vendors who had some coffee who was there, we were talking. It's about 12:30 at night, and we're watching all the students. He goes, "I think this is pretty successful." I said, "Well, how do you know that?" He said, "Look around. No one has their cell phone out." And they didn't. And it was incredible to see that too. So I think we're making some headway, but we still have a ways to go. One of the things that we did was we partnered with a local counseling group, an agency, and we are now a site for them. So instead of students having to leave school and get their parents off work to go see their counselor, the counselors come here. And that has been huge and we also have it set up where if we have an emergency, we call them, they're here in a heartbeat. I mean, it's so we don't have to try and deal with that wait time. I know there were some principals around the Columbus area that said if they'd make that phone call, it might be 6 weeks before that kid could get in and see somebody. So we're pretty fortunate that we have that. We also work with this group that we've identified about 15 to 18 students who are really kind of at risk for a lot of factors. We call them our dream team. And so the counselor comes in and meets with those kids once a week, every Thursday. And those kids absolutely love it. And you'd be surprised how much some of them are talking in that group rather than just sitting back like we thought maybe they didn't really want to share. We're also fortunate that our county mental health board has secured some funding for 20 hours. Each school in our county is going to have 20 hours of a counselor coming to them next school year. So it's a little bit of help is coming, and we're starting to see some things out of some legislation. We're starting to see some of that funding put into play here. Another school, they did a 15 minutes of a staff meeting every week. They do a book study and they call their Wednesdays Wellness Wednesdays, where the staff would wear workout clothes. Classes might go out for a walk. They're a little more focused on lunch that day, being a little more healthy. So that was one thing that up in Anthony Way near Toledo, they were doing. There's one school I thought was really interesting. Every Friday, they run a special schedule. So starting at 12:30 on Friday for 45 minutes, they do focus on academic time, getting kids caught up on work. Then the next 45 minutes is a club time where every kid's in a club. Then they end the day, the last 30 minutes, it's a whole school assembly. Might be a pep rally, might be some class competition, might be your band or choir doing a performance. There's something that they do. I thought that was pretty ingenious in trying to help their students too. We're seeing everything from courses that are being offered to we're seeing some schools that are using animals. Nelsonville, York actually made the New York Times showing what they were doing. They actually brought in horses one day into their school, and the kids would go out and pet the horses. And so those are some things that we're seeing. even our military is kind of getting involved. The U.S. Army, they're sponsoring working with our FFA organization in Ohio and working on a leadership camp. So they're trying to do some things to get kids to develop their leadership skills so that they can, again, have that more of a sense of belonging and encouragement and strength actually too. We know that the shortage of school psychologists is huge. The recommended ratio is one counselor to every 500, or one school psych. In Ohio, it's one school psych for every 1,084 students. So we definitely have a shortage of psychologists. One of the things that I think that we need to just keep beating this drum and just keep continuing is talking to our legislators about funding. We're seeing programs that are put in place, and the only reason that we're able to do these things is because of money we receive from the federal government. And there are things that are working. We just can't stop now. If all of a sudden we're trying these things and we're having some success, and then the funding gets cut and they say, okay, districts, now you got to do it on your own, it's not going to happen. And we're going to be back to where we were before. So when you get those action alerts and when you see those things, it's really vital that everybody contacts their legislators and we provide this funding. We know that our teachers are getting burnt out. When they're having to focus on the social and emotional stuff, as well as their class and testing and all the other things that go with it, they're getting burnt out. And when teachers leave, there's going to be a shortage of administrators. We have a school here local, not too far away, that has had a math opening now posted for 2 months and no one has applied yet. And that is crazy that a few years ago, we would have had a lot of people applying, but for 2 months and they had nobody apply yet. We're having to get pretty creative on some of the things that we're doing and scheduling our classes. But we need that funding to continue. So all the things, it's nice to see, and maybe we can continue to tell these stories about what our schools are doing and what's working, because that can definitely help our legislators see that we're not just wasting their money. We are trying to really, really help our kids. And I don't think we have to convince any of us that our kids are struggling, our teachers are struggling, our counselors are struggling, and we need some more help. So keep up the good fight, keep going, keep working, and hopefully we'll get through this stuff here, get through some of this crisis pretty soon too. So I'll turn it back over to Jen then. Thanks.
Thanks so much, John. Really appreciate all those sentiments. So valuable, especially asking Congress to keep up that funding and sustainability. Let's have Myelise next.
All right. Can everybody see my screen here? The resources have been dropped in the chat, but I'll just go through. I took some screenshots of them so that you can just kind of get a visual of what these different resources are. And Jen, I apologize. I keep correcting where I work, and I'm in Oregon. So Lincoln County, Oregon, we have a tiny little town called Toledo right on the Oregon coast. So
No
so one of the resources that was dropped in the chat is Oregon's mental health toolkit. It's free on the Oregon Department of Education website, and everything is framed around these areas. So I don't have screenshots of every component of it, but really centering mental health around trauma-informed care, strengths-based education, centering ourselves in equity, and then having SEL be a real driver in the work that we do. And in the toolkit that's available for parents, for students, for educators, for counselors, has different avenues for all of them. There's just resources that speak to each one of these areas. And Oregon, I know lots of states, not just Oregon, but we've really made a big push around the importance of student voice through all of that. So there's a toolkit in there for student voice as well. And one example I'll give on that is every year, our Indian Education Department in our county, which serves 6 high schools, it will put on a wellness day. And it was important information that was being given, but this year they asked the students, what do you want to see in your Indian Education Wellness Day? And the students said, we really want to see stuff that will make us well. Like, we know stuff's not great, but what do we do when we feel down? What do we do when we're having thoughts that are not comforting thoughts for us. Like, how can we get ourselves out of that? And it was amazing. And so tribal elders came in, our Indian education staff came in, and they just did activities and provided resources for kids to do so that they can feel well, and made it very culturally responsive to them. And it was a really supportive day for our student community that we wouldn't have done if we continued to be the adults seeing the facts, saying this is what we need to teach them about, but really listening on what they wanted to learn about. So that's just one resource that there's a link there for, to see what Oregon's doing and see how you can use that as well. The next one on here is Work to Be Well, who's partnered with NASSP before. Work to Be Well has done a lot of work in Oregon. Providence is based, I don't know if it's based out of Oregon, but we do all of our work with Work to Be Well in Oregon. They've done school visits. I just took a screenshot of this one so you could see a number of their free resource topics that are available to you, and toolkits that are available. Very student voice heavy, which is really fantastic. It's very, very relevant work that they, I've done a lot of work with them on lesson planning for educators, and there's always students part of the vetting process of those lessons before they're pushed out to be given to educators to use. Lots of parent resources as well. So I really encourage you to take a look at this resource when you have time. And then whenever Work to Be Well is part of work that NASSP is doing, it's a great resource. With Work to Be Well, these were just a couple others. So one of them that we brought in and we did at all of our schools was the Emotional First Aid Toolkit. They came in and helped our student leaders, and then student leaders were able to work with student body through homeroom on how do we make this kit for ourselves when we need to de-stress, or when there's stuff going on that we need help taking care of. What are phone numbers that we can call that we can have readily available? So that was just another Work to Be Well screenshot here. Hashtag I Can Help. I was really excited when Jen was saying that we're going to be doing work with them throughout this partnership. We do a ton of work in Lincoln County School District at all of our high schools with hashtag I Can Help. They were just here doing school-wide assemblies. They do parent nights for us as well. They've got toolkit resources. Again, they work heavily with students on vetting their materials before we push them to students and getting student feedback. I was with them recently working with local law enforcement as well on when local law enforcement stepping in with a crisis that has to do with internet, social media, or could be spread on social media. They're dealing with parents when it's summer and we're not there to help with that. And so providing resources to law enforcement on how they can help families navigate through social media crisis and trauma. I think that they do a really excellent job of understanding that the educational community is far beyond just the building that they're serving in. And so when you're working with them or getting their resources, they're very comprehensive for all of the people that surround our youth and work with our youth every day. And the last one that I have is a new Ken Burns documentary that's out called Hiding in Plain Sight. If you haven't seen it, it's on OPB for us, but you can get it off PBS. I think you can download it on Amazon as well. It is one of the best mental health documentaries I have ever watched. And one of the resources working with Work to Be Well that will be coming out are lesson plans that can be used in the school that go with each one of the chapters. So you can see on here in the bottom, an episode itself is 2 hours, but it's broken up into short chapters that could be done in a health class or in a homeroom. You can pick and choose between all of the different aspects of mental health that youth and families go through on a really regular basis that we don't talk about. And so they follow a family through just a continuum of a mental health cycle, that it's not one and done. It doesn't happen and then you're better tomorrow because you got some help. But what's that ongoing support look like? What happens if there's a relapse? How do we just continue to love and support and give guidance all the way around for everyone impacted when youth are in crisis and youth are struggling? So it's a great documentary. The lesson plans that are coming out, again, I think are really fantastic. They were built by teams. The teams had one of the writers or a producer of the documentary itself. They knew families well, they were living in that world, so they could make sure that we were true to what the story was that they were telling. It had an educator on there. It had a mental health provider, which I thought was fantastic because I was one of them and I had my educator lens, but I could be doing damage if I don't know what I'm doing about mental health truly. And so having a mental health care provider there, watching the activities and lessons we were coming up with and supporting was really strong. And then I think I already said they had youth on there who had no problem shooting us down when we thought we had a really great activity. And they would say, yeah, no one cares about that activity. And they would really help us on how can we have this great information that will reach our audience correctly. So that's a great one to watch, just even for your own learning. I've watched it multiple times and get something out of it every time that I watch it. Last couple of things that we've done, we've greatly increased our art funding. Oregon has a student investment account that has put money into a well-rounded education, and many, many schools in Oregon increased the arts funding because of that. In our county, we brought in the music first, and now we're looking at local partners. We only have so much money. So now local partners on how we can do more with visual arts and make that readily available for students. We've removed all of our athletic fees and all of our participation fees for clubs and programs so that we can get our students connected. And then our district K-12 has 5 minutes of mindfulness every day. To be honest, it goes well in some classrooms and not so well in others, but a lot of our educators have said they need the 5 minutes, maybe more than the students at times, so that they can just recenter. And we provide activities for 5 minutes that they can do in ways that we can help. So that's what I have. And I think everything was in the chat. So
thank you so much for sharing all that. And yes, to answer someone's question in the chat, everything will be in one document and shared out afterwards. Okay, that brings us to our last school leader speaker, Chris, before we invite Jeremiah to share a few words as well. Chris.
Hey folks, no, I don't have anything to share. I'm just going to sort of talk over my links. And actually there was one missing, Greg, and the VHI Path to Wellness. If you get a chance to throw that into, that'd be great. I had to actually chuckle when John was telling the story about the prom. I agree that ours was successful and that we didn't see many phones out up until the point where the chaperones took over the dance floor. Then every single phone was out and filming every move that we were making. So I'm sure there's video out there somewhere, but it kind of reminded me that if we're not willing to kind of model vulnerability and fun and, you know, how to put yourselves out there for kids, and it's tough to ask them to do it. So, you know, that's a lot of what we try to do is to, you know, look for opportunities where we can interact with kids as partners in learning, both in terms of academics as well as in terms of wellness, and really just to be there with them as we're doing this journey together. The links I provided, we'll start right with the Hope Happens Here. This is a student-led organization that was actually started in Vermont at St. Michael's College, and is a mental health and wellness initiative that again is run by students. And we had this chapter in place. It was kind of it's based on athletes who want to destigmatize mental health issues, and it was super helpful because we unfortunately had 2 student suicides within a relatively short amount of time. And as you all probably know, when something like that happens, students want to do something. And as adults, we can obviously walk them through it and, be there for them. But this overwhelming desire to help, to do something for their peers, this was an outlet for that. And so they were able to put marches together. They were able to put care baskets together for the families. They're able to support their peers, and it's really not it's not sort of heavy duty therapeutic stuff. It's just kind of stuff kids do, and it gives them a structure to do that. So I would highly recommend taking a look at that if you get a chance. That work doesn't, as you can guess, probably doesn't just happen because we have a chapter. We also have a pretty robust mental health and wellness committee. Our mental health and wellness team. We've worked over the last few years. we're a school of 700 in northern Vermont, pretty rural area. We actually have 11 licensed counselor type folks. That's 6 guidance counselors, 3 school-based clinicians, and 2 social workers. And that work sort of nestled into, our daily work. And it kind of creates these spaces where students, I think, feel safe, and are willing to sort of step out of their comfort zones to embrace the idea of health and wellness. And again, the work has been, I think, pretty satisfying to see unfold. And the other two links I shared, one is the VHI Path to Wellness. This is our statewide insurance provider for Vermont educators. This was and I'm sure you all have similar things in your states, but this is just our version of kind of these little wellness programs that staff actually put on for staff. Every school has a VHI Path Wellness coordinator. It's a stipended position, and they organize all sorts of fun little challenges, whether it's a sleep, get the right amount of sleep challenge, whether it's go for a walk challenge. There's little prizes at the end. And again, super light stuff, but it does sort of bring the topic of wellness into our consciousness in enough of a way to say, hey, maybe I shouldn't just stay here till 6 o'clock at night doing emails. Maybe I should go meet my friends for a walk by the lake, or maybe I should go walk my dog or something along those lines. And again, that's all staff based. It's not, we're certainly willing and able to do a lot from administrators' point of view of doing things for teachers, but when it comes from peers, I think it's a lot more powerful, and they just see themselves in the work and are more willing to access it. And then the last link is what is our Invest EAP. This is a service that's available to all state employees. And anyone can pick up the phone and call and talk to a counselor immediately, and are eligible. I think it's up to 3 consultations. So again, it's not deep therapy or anything, but it's someone at the end of the line if you are experiencing some difficulties with your life. I've actually used this as an administrator with staff who are struggling. It's super helpful. Like I'm just so impressed with the quality of care that exists within that portal. And in informal conversations with our Secretary of Education the last couple of weeks, we have another version of that coming online just for educators, which is a more acutely focused helpline for folks who are experiencing particularly mental health crises. So, and that I believe is up to 6 consultations. That is likely to be more intensive than just kind of checking in with someone. So again, I'm sure you have all similar things in your states, but those are models that we've used. I can't say enough about how important it is to have student-led initiatives talking about mental health in your schools. They do, every time they do an event, they get a different T-shirt with a different saying on the back. Either it's okay to not be okay, or you're loved. And by the end of the year, every kid has a T-shirt that has some positive saying on the back. And without even knowing it, they're like branding it themselves. So I think it's really kind of a cool program. So back to you, Jen.
Thanks so much, Chris. Really appreciate you. Okay, that brings us to Jeremiah, who's here with us and sharing a little bit from the student perspective, but also his own experiences. Please share a few thoughts for a few minutes. We've got some time left over. I think maybe a question or two, but go ahead, Jeremiah. Thanks so much.
Got it. Thank you so much, Silva. Hello, everyone. My name is Jeremiah Castillo. I'm the 2023 National Honor Society Scholarship winner and a senior here at Technology High School in Newark, New Jersey. And this, actually not this upcoming fall, this summer, as part of the Rising Scholars program inaugural cohort at Harvard College, I'll be starting my journey in undergrad for the next 4 years. And even recently, I've been honored by the New Jersey Senate at a ceremonial resolution. It might sound like I'm bragging at this point. I promise there's a point that I'm trying to bring up, because not all of these successes came from just, wanting to, just get there. It came from working hard. Well, the drive for me to work hard came from a pain, right? I turned that pain into a purpose, and that pain was my father's passing on May 27, 2021. And since then, I've dedicated myself to leveling out health disparities. That's become the purpose of that pain and what I plan to do as a neurosurgeon and future public health advocate in both the political and medical sphere. But that's not a miracle that happens for everyone. As we know, within the American educational system, there's a lot of times where the therapeutic infrastructure that's meant to be within schools sometimes is lacking or isn't present. And just overall, just to define the idea of what therapy is in of itself. Therapy is the idea of, being able to go to a person or an entity and be able to like separate yourself from all of the negative influences or external influences within your life to be able to just, work one step at a time towards reaching the goal that you're meant to work on by conditioning yourself in a positive direction. A lot of times, if we have infrastructure that's ineffective or infrastructure that's effective but misplaced, we're still not getting anywhere with this, especially in the educational system where students are meant to, not only be on a path to be railed on, but also make sure that once they're on that path, they don't derail, and that we have safety measures and protocols to make sure that, whether it might not be behavioral wise, but, up here, that everything's going on in a healthy way, and that they're taking care of themselves and also prioritizing themselves. Because of course, there's always that saying about finding that work and life balance. And that's something that's extremely important for every single one of us to find, especially for students that we define as the future of America and the future of our world. But most importantly, out of all of these sources as well, I want to touch on the topic of the primary advocates at home, which are the parents. Many times there are parents, we all know that one parent at our school that's a diehard fan of their child and is always there for them. But many times, unfortunately, there's a lot of parents that are absent in that advocacy because they're not able to be able to, through the education system, not only have their child educated on mental illness, but also have themselves educated on mental illness and demystify and destigmatize all of these different topics that are usually just looked at as, oh, mental health and mental illness is just, a generic broad topic. It's not the same as any other physical condition that a person might have. For example, a cough or like a genetic disorder, when in reality it is. There are scientific explanations for every single one of these disorders, but a lot of times we have a lot of ignorance that's involved, which, isn't bad as long as we're willing to learn more about the situation. And this goes back still to the definition of misplaced infrastructure. I'll give you an example. When my father passed away, that was when I learned that my school had a social worker. I learned what a social worker was, not only as a career, but also that I was somebody that I could go to. And that came by the time that I was already becoming a rising junior at the end of my sophomore year. And there were so many things that I didn't know about being virtual, as many other students have been virtual. That's been a great interruption, within every single one of our education systems, and just overall, just getting accustomed to being, in the real world and not looking at each other across the screen. That's something that I missed out upon, that to the point where I missed the day where my father had passed away within classes, but I came in the next day, whether I was crying, just with my camera off doing the work. And a lot of times, there's students who might say, oh, I feel like, I came out of virtual learning. I still feel like I'm 12, even though I'm like 15. And a lot of times it's because, we haven't had those real life interactions to be able to learn, or these resources haven't been put in the face of these students to be able to, have them understand that it's okay to, not be okay, how we were saying earlier, that there are people here who are for you and there's an infrastructure set in place. And yeah, there was teachers who intervened, but a lot of times that's insufficient. In my case, it was sufficient because it was a teacher that I had a great connection with. But for many students, unfortunately, that circumstance that they might be facing, like their father's passing or any other critical condition that they're facing or going through, might become the narrative of their life. And it might take them down a path that, isn't so bright. And, like I was saying, not everybody has a miracle. And, imagine this was just with a situation where there was misplaced infrastructure. Imagine in a school or a school district where there's no infrastructure. And that's why I greatly appreciate, just being able to hear the other folks speaking, the other school leaders, even though I came in because I'm still getting ready for my prom, which is actually today. It was really nice to be able to hear like all of the systems that are in place to be able to, help, disseminate information a lot that a lot of times is lacking, especially, let's say, going back to the idea of parents and how they're primary advocates, and the idea of demystifying and destigmatizing, just to take a quick pause and show you guys what I found on the Merriam-Webster dictionary. Okay, sharing is actually unactivated on my end, but on the Merriam-Webster dictionary, the definition of destigmatize is to remove associations of shame or disgrace from whatever the topic is. And the first example is destigmatize mental illness. That shows how great the issue is, how little we know about mental health and mental illness. And being able to actually grab these primary advocates from home that are going to be the ones fighting for their children, fighting for their future, the ones that give these students structure within their life, because structure doesn't start only at school, it also starts at home primarily. There can be solvency through programs that can intervene and also provide this information and dissemination of information to parents to really help them understand what mental illness really is and the importance of mental health. A lot of times, especially in households where there are low resources, there are other priorities, but this should be a priority that's brought up because you can't give what you don't have. And if not everything's running well in your mind, then you're not going to be able to give to other people if you're not managing the situation correctly. And that goes even into the issue of we can't solve an issue if we don't identify it, whether it be parents or administrators. A lot of times there's stubbornness in mitigation, and that makes change in mitigation impossible. And I think it's very important to have these kinds of conversations, because not only do we incite the spirit of, encouraging school leaders, whether it be a student or an administrator or staff, to really go out and fight the good fight in terms of bringing awareness to being well. We also instill hope for those that are going through situations like the ones that I had to go through, unfortunately, so that we can still come out the other side with our full potential unlocked by that one individual that touched our hearts. So just to close it off, I think that if we like calling, giving our students the call to be the nation's future, the world's future, we have to treat the future like the future that it is and the future that we expect it to be. So that's all that I have to share. Thank you so much for the opportunity. Thank you.
Jeremiah, I mean, I don't know about you all, but my heart is really touched. And thank you so much for sharing such an incredible story and your trajectory. And we wish you nothing but the best. And that's why you are an amazing school leader. And I mean, you have just your sights ahead of you. And so I know you'll have an amazing time at prom tonight, and an amazing summer as you get ready for your next stage and chapter in your life. So congratulations. I know we're a little over, but I'll take a couple minutes here just to do a roundabout with everybody. If anybody else can stay on as you maybe give a 30 seconds or 45-second close and thoughts. We did have one question, and as we transition from what Jeremiah is saying, identifying mental health issues, best and appropriate courses of action to refer students to mental health professionals and or those that can help in the school. So just as you close, maybe you can share something about that, and maybe we can go in the order of those that were speaking in our school leaders and anybody else that wants to jump in. Jen, Karen, Elizabeth, thanks.
Well, I mean, I'll just real quick. I mean, it was amazing what we did to kids a few years ago when we sent everybody home. We removed them from their support structures and we put them on a computer. I'm not sure we could have done much worse so it's no wonder that we have some mental health issues. But like I said earlier, as long as we can continue now we've identified the problem, we continue to keep fighting it and keep sharing these stories that are out there, I think we'll come out better on the other end.
Thanks, John.
I can piggyback a little bit on that. We use an SEL screener. It's actually it's identifiable. Students are providing their names, and just as an example of the difference between pre and post pandemic, I think we had about 90% of the students participate and give their names in the SEL screener prior to the pandemic, and we're closer to 50% now. So I think that there's definitely some broken trust, even though it was really not anyone's fault, but students are taking a while to recover from that. But we do use that data to identify sort of a high risk score for any students, and obviously just ears to the ground and relying on connections that students have with teachers so we can respond as quickly as we can when an issue comes up.
Thanks, Chris. Aaron, Elise?
I'm a big believer in that, if you can take your counselors, your child study team, your related support specialists, your mental health professionals in your building, and give the appearance that they are on a pedestal, they are pseudo administrators. I think that's a really important mechanism that accomplishes exactly what Jeremiah was talking about. Jeremiah, I was touched by when you said that you didn't really understand or have an understanding of what a social worker was until you actually needed to utilize that resource. And that to me is something that I think is happening in a lot of schools. And I think school leaders have an obligation to make sure that their staff and their students are well aware of those kind of mental health supports that exist within the schools. And then allow for those people, the social workers, the psychologists, the counselors, to make the professional recommendation if they have to seek a higher level of care. But I think the only way that happens is if principals go and treat their child study team, their counselors, their mental health professionals as though they are pseudo administrators in the building, so that the rest of the building looks at them and says, wow, the principal really listens to what these people have to say. Because students, the unfortunate situation that Jeremiah's had brought him to a social worker. And that was great that eventually you got access to that resource. But there are a lot of kids, I think, who go through who really would benefit from that resource, that principals have an obligation to make sure that everyone knows what those people do in their buildings and the critical piece that they play within the school on a day-to-day basis.
Thanks, Aaron. Elise, any final thought?
Yeah, just really quick. I agree with that. And I appreciate hearing that comment too. That's something we noticed, that our students didn't even know the resources that we had available until we could ingrain that into systems preventative, so that they were really seen as the resource. The other thing we learned is working with teachers, because the more resources we have made available, which we have drastically increased, still not enough, but much better, it pulls kids out of class to get that help. And so having teachers really understand and see the importance of the value, and they do see it, but when it impacts them because they've got a kid who's missing their class or two kids that are missing their class, if it's small group, how do we have that mental health not be something that kids are afraid to take because they don't want to miss class? And so really working as an entire system to prioritize mental health, just like we look at, when the soccer kids have to leave, people are frustrated when they leave, but they make it work. And so how can we make it work and really not demonstrate any frustration for a child who needs that service provided?
Thanks so much. Beth, any thoughts?
I can't get myself off mute after all this time. No, I really sit here as a policy person and just marvel in all the great work that you all did during the pandemic, in a time when it was like no other time, and how we're learning our lessons from what happened, and will help us in the future in a number of areas. So thank you to all of you for the amazing work you did.
Thanks so much for being here. Jen? Any final thoughts? Okay, thanks so much. Ron, I think he's still with us. Any final thoughts from Ron?
I'm just really grateful to everybody who participated here. Like you, I've heard Jeremiah's. What's up, Jeremiah? How you doing, brother? I've heard him speak a bit, and so it's not hard to get to see why there's such a special young man. But having each of you here, the wealth of information, it's in the chat, the wealth of information that was exchanged today, with so many of our children and families going through tough times, and so many of our brothers and sisters in the field and in schools struggling with issues. It is really comforting in a weird sort of way. It is really comforting to know that with just 8 people here, the amazing amount of information and service and talent and experience and expertise and insight. It's a real call to action for us at NASSP about how do we connect every single one of our members, every single school leader with other school leaders, because the solutions lie within. And in this case, in partnership with other like-minded, powerful, service-oriented organizations. I mean, our ability to do good work together is really, unparalleled and frankly untapped. We haven't yet realized what that looks like when we're all firing on all cylinders together. So I just really want to thank every one of the panelists and speakers today, not only for their leadership in their respective fields and in their particular jurisdictions, but really for making the time to come together and share their expertise here. As the school leaders in the room know, it's not our first thing to go out and share what we know. Usually we're trying to, we have great teams and we're trying to listen and learn. And so I realize it's a bit of uncomfortable for some of the folks to come on here and talk about these amazing things that are happening in their buildings and in their jurisdictions, but it is necessary because you are all the ones who are actually dealing with it on every day. And I enjoy research and I enjoy theory and I enjoy, people talking about it. But I much rather gravitate towards the people who are actually rolling up their sleeves and doing the work. And ultimately, in the case of Jeremiah, the people who are either benefiting or not benefiting from those services, because that's where the rubber meets the road. And that's what we're about here at NASSP. So my long-winded way to say thank you to every one of you for not just the work that you do every day in your day jobs, but for making time to be here to share your experiences with others. And thank you to our partners who help us sort of advance the mission together. And we rely on you for your professional expertise and could not have thought to have a better group of folks here. So thank you very much. And in the theme of our webinar series, everyone be well.
Be well, everyone. Thank you so much. And thank you to our audience for listening in, and please enjoy the rest of your day. I know we went over, but the resources will be following in links and emails. So please join us for our next webinar. Keep in touch with us. You are not alone and we cannot do this alone. So thank you for joining. Be well, and we'll see you soon. Thanks so much. Bye.